Hi. So today we have a very distinguished. No, please. Hello. Hi. So today we have a very distinguished doctor with us today. Hello. This is Dr. Manish.
Hi.
And he is the HOD of Gynecology at Scientific Research Institute at Surendra Nagar, Gujarat. So welcome, sir. Welcome
Thank
to
you.
our-
Yes, Yoji and your stall.
I am Dr. Krishna Deepak. I am a physician based in Hyderabad and I am also the Chief Medical Advisor for Biologically. So, sir, today let us talk about the iron deficiency anemia and what is the status in our country of this iron deficiency anemia.
If you talk about iron deficiency anemia, it is the most common anemia pertaining to a pregnant woman.
All right.
It also affects the child, it also affects the postpartum woman, and it also affects the geriatric population. Because in our food we are not taking enough iron, and we all know that Fe has to combine with vitamin C, then has to absorb through the duodenum, go into the circulation, meet the storage, and then make ferrous Fe to Fe plus 2, and it will run our body in RBCs. So if it is not sufficient iron is there, you got all the problems of iron deficiency anemia like fatigability, weakness, malaise. Particularly in pregnancy, when there is a low iron, baby is also getting less blood and less oxygen supply. So it is a big problem, sir.
So, as much as I have studied and I have seen in my practice, and what I have seen is that as per National Family Health Survey 5, almost 57% of women of reproductive age group
Yeah.
are iron deficient.
Yeah, absolutely right, sir. It is there, and
Does
it is
it reflect in your clinical practice also?
because it reflects more in my practice, because I am coming from Gujarat. I am coming from the town which is 80% vegetarian based. I had practiced in France also, where I had never seen any patient anemic.
Okay.
Okay,
is
but
interesting.
that is because they are taking
Right.
all sorts of meat iron, and that is very good for consumable. You can remember that one of the company has came with hemoglobin. That is iron source taken from the pig, and that is a myoglobin that convert into hemoglobin. But because it is coming from non-veg source, now this iron is banned in India. But in India, because of vegetarian food, we are not taking that much of green leafy vegetables. Even there is no spacing between the pregnancy. So this reproductive age group, you have talked about 57%, it may goes high when there is no spacing in between the child. So you see, there is an increase in the burden of a lady and the society, because anemia is not reflecting on an antenatal part, it also reflecting on an intrapartum part when she has to take very good oxygen and have to push the baby. As well as in postpartum, it also requires for the involution of the uterus, and if she don't have to take the infection or puerperal sepsis, good iron storage should be there. So it reflects woman from antenatal, intranatal and postnatal part.
Okay. So, not only to say the mortality is very high
Yeah.
in anemic patients.
Yeah, absolutely
anemic
right.
pregnant women.
Yeah.
And adolescent girls, what is your experience in anemia?
Adolescent-
Have you seen lot of adolescent girls with
Adolescent girl, particularly girls, those who are suffering from puberty menorrhagia, irregular periods, frequent periods, loss of blood in this menstruation, not taking proper iron. You see, in European countries, so many countries have started wheat with fortified with iron, wheat fortified with folic acid and iron to nurture that family. In India, it is not there. Now he had got impregnated only with iodine. No other elements are
We
added.
are seeing vitamin D. And
Vitamin
things
D
like
and
that.
but
We are not
but
seeing
this adolescent girl is also suffering from anemia because of puberty menorrhagia.
iron. So, my understanding is not only this, we have PCOS condition, which
Yeah.
is a new age kind of new working women under stress. They are also having a lot of menorrhagia. They are also having inflammatory markers which are higher, metabolic syndrome, which is actually leading to less oral iron absorption. Because of
Basically, now PCOD is not PCOD. It is not polycystic ovarian disease.
I
It
agree.
is polycystic ovarian syndrome, and
Absolutely.
it is a metabolic disorder.
Yes.
So all this young lady, we cannot say this junk food had increased PCOD, but because of diagnostic accuracy of ultrasound, so many times we are misdiagnosed. So many girls who have got little bit cyst considered as a PCOD, but PCOD is lots of burden to the society. They have got irregular periods, either frequent periods, oligomenoria, infertility, obesity, lots of problem are there with PCOS.
Absolutely.
So iron is in our body. As male, we don't have to suffer from menses and pregnancy, but female has to suffer pregnancy and menstruation every monthly. So she loses blood, she loses her amount of iron. So iron should be stored in her as much as possible to have minimum problem in their life.
Absolutely agree with you.
Yeah.
My area of interest is PCOS.
Okay.
Yeah, chronic inflammatory states in the body.
Yeah.
As you very well know, they increase lot of hepcidin.
Yeah.
That will lead to decrease in oral absorption.
Because hepcidin block is there. There is
Yes.
no absorption of the capacity.
Absolutely.
Here one molecule came in market, that is FCM, ferrocarboxy maltose, which doesn't require hepcidin.
That is true.
That is true. So that is the beauty of that molecule. I am happy to share that in 2005, when iron sucrose came in market, we had done 500 patient study on iron sucrose. You won't believe that auto dilution dose was designed by us in our medical college. In iron sucrose, we are taking 5 ml of iron sucrose, one butterfly, one 10 cc syringe. We are diluting that 5 ml into 5 ml of blood. So it is at 10 ml. Slowly we are injecting into a woman. I had taken more than 562 presentation pan India to make people aware that there is no harm in giving injectable iron. Because whatsoever studied in our literature, in our study when I passed in 1995, at that time was available was Dactocos, that is injectable iron which is painful, and iron dextran, that is an injectable iron. And we are giving in TDS, total iron infusion. And we had seen lots of patients with anaphylaxis.
Yes,
So
true.
whenever I have to give iron in my residency, I have to sit next to the patient. So this is impression coming in common gynecologists that injectable iron causes anaphylaxis. To get rid of that impression, we had done this study. First, I am giving iron sucrose with auto dilution dose. Then I will talk my presentation on iron sucrose. That this is this much Dalton, 50 to 62 Dalton, iron sucrose is there. You can give injectable. According to the Ganazoni formula, you have to calculate the deficiency of iron and you can inject 1 ampoule, 3 ampoule, 5 ampoule, daily, alternate, weekly basis. I am happy that after publishing that paper, when Narendra Modi was there as a chief minister, he had supplied this iron sucrose free to all PHC and CHC. And now it is customary that every postpartum lady should get 2 ampoule of iron sucrose free of charge. So that will build her iron storage in next pregnancy.
What is your
Then second baby came. That is ferrocarboxy maltose.
I would like to know more about
Yes,
your
yes.
experience with this.
In 2017, your company probably had not introduced FCM in 2017.
Absolutely.
Only one company was there, and on that company, we had done paper on 478 patients. This is a prescription-based study. There is 2 strengths available at that time, that is 5,000 and 10,000. It is very costly at that time.
Okay.
So we had done prescription-based.
5,000 and 10,000?
That is the injection concentration.
Concentration.
At present, you are giving FCM with strength
500 mg.
500 and 1000. Sorry, that one slash is more. तो
ये कट कर दो.
ये कट कर दो. थोड़ा कट कर दो 5000 10000 वाला.
वो
500
वाला भी
and
कट कर देंगे.
थोड़ा कट कर दो. अब ले लो. आपको मैं खदीरा दीवती देता हूँ.
ये बस है सर.
हाँ, अच्छा. ओके, सो FCM से चालू करते हैं.
हाँ, वो तो बाद में हम
कट दो.
कट और पेस्ट कर
So
लेंगे.
FCM come in market as a 500 and 1000.
1000, yes.
1000 was very costly. Only fallacy or disadvantage of this molecule FCM is you have to finish that molecule within 15 minutes of time,
Okay.
and that you have to give in 100 ml, because after constituting into a normal saline, if you continue it for 1.5 hours, then the potency of that iron goes.
All right.
So you have to finish this within 15 minutes. Either you give 500 or 1000. And that you have to calculate according to the Ganazoni formula.
Ganazoni
Okay.
formula,
So this is a second molecule. It came wonder in market, and I am happy that now the what you call it is a property or whatsoever something has gone of FCM,
Patent.
a patent, something has gone. So now prices come to very low economical prices to the patient, because we had purchased in 10,000 rupees, now it is coming in 1,500 or 1,700 rupees. So you see how much cost cutting is there when patent goes. Just like patent goes for dydrogesterone, just like patent goes for Vicryl. So you see, so this is now cheaply available. This can build, because it is a hepcidin blockage free iron. Ferrocarboxy maltose is going into the storage, so it will help lady to have a more nourishment. Then third iron came, that is iron isomaltoside.
What is
We
your
had-
experience with that?
I had also used iron isomaltoside in 200 patients, and we had
Alright.
published paper also. It is also a very good molecule, because if you see, FCM and isomaltoside are younger and older brother. Maximum paper of both these iron are available on renal diseases.
Absolutely.
In chronic renal diseases, because of low availability of, okay, you can call it as the iron precursor, that is coming from the kidney, erythropoietin. Because of lack of erythropoietin, this all patients are suffering from iron deficiency anemia. So lots of study are there of iron isomaltoside and FCM on these renal patients. From that, we had taken into the gynecology that if it is helping in the renal patient, why it won't help in the gynec patient. If you compare, both are younger and elder brother. Only advantage of iron isomaltoside, you can give full dose. You can give in a 500 ml of bottle. You can make it slowly for 1.5 to 2 hours, and it will give you complete dosage requirement. Otherwise, FCM you can give 1,000, but you have to give 1,000 weekly. You cannot give FCM 2,000 in a day.
That's true. I
Okay,
agree.
absolutely agree. So iron sucrose, FCM and iron isomaltoside, you can see on my Orchid ID, all these papers are there. 117 papers are there on Orchid of mine, that you can see all this study.
Excellent. So I got a lot of insights,
Yeah,
but I would like to add few things.
Yeah.
Because I worked with the molecule very closely.
Yeah.
When we launched the API, it is our own API.
Yeah.
We are actually supplying to major pharma
companies.
and
Previously we are marketing and just making a sticker. When 2017 I started using FCM, it is coming from abroad with
Yes.
a good cover, and we are putting our own name.
Label.
Just suppose my name Manish Pandya, then it will be mine. Okay, so it is like that. Now, but India are making
we are
API,
making our own API.
so that's very
But
good.
This is a very complex molecule.
Yeah.
That is one thing. Second thing, I have studied about iron isomaltosidase. And I find that what you're saying is true, that we can give a higher dose.
Single dose at a time.
Yes.
That is the only advantage.
But there is one study which I read, which shows that labile iron is a very important concept.
Yeah.
And of all the even newer generation, and iron sucrose, fermoxytol, iron isomaltosidase, ferric gluconate, FCM has the lowest labile iron
Yeah.
releasing capacity. That's definitely an advantage.
That is advantage.
Because the cell destruction, because of the free iron, is very limited with FCM. That is one thing I feel is
It's
the
absolutely
advantage
true,
to-
and that's why you can see at present, I could say that there are more than 100 companies are marketing FCM, and
Yes.
there are only 2 companies is marketing iron isomaltoside.
And it's not.
It's not that much popular. It
Yes.
is not that is picking up.
Yes.
But if you see, there is advantage and disadvantage of both. Disadvantage is free labile iron, which will act as a necrosis to the cell.
Yes.
It will increase ROS formation also.
Absolutely.
But there is advantage of full dose iron. So it has got one segment of patient, those who are severely anemic, those we are not able to give blood transfusion, and we want to replenish the storage in a single go. Particularly the patient, cancer patient, in those we have to operate, or those patients who are on palliative treatment in this type of segment, or a severely anemic lady postpartum or geriatric lady. In this type of population, when it is required, we can give it. Otherwise, FCM is a good molecule. That's why more than 100 companies marketing FCM.
One more thing, small
Yeah.
thing I would like to add.
Yeah.
There is a study,
Yeah.
and now the FDA has come up with,
Yeah.
that is American FDA. They are saying that for all the parenteral iron injections, only FCM is, indicated for heart failure patients.
Yeah.
No other iron preparation is given.
Why? Because it doesn't cause overload.
That's
because you are giving in a 100 ml bottle.
That is true.
No higher dose is given, and you are giving at a stage 500 2000 only.
That
So
is one thing.
that is the advantage.
Which has actually goes in favor when
Yeah.
you have comorbid conditions.
Comorbid condition patient who have got recent myocardial infarction and not able to have a good oxygen carrying capacity, in this type of patient you can give an
So
FCM.
these are some of the advantages for
Yeah.
FCM I've seen, and we have now having long-term data,
Yeah.
and you are a very big contributor for this long-term
No,
data.
no,
We
no.
are thankful to you. And what do you think is the role of FCM now presently to treat IDA in India? How important is it?
Since the beginning, I am telling you that iron deficiency anemia is at the higher, particularly in Gujarat when we have got most of vegetarian population. If you don't want to give blood transfusion in a patient, if you want to replenish the iron storage in between the spacing pregnancy, during adolescent girl, during puberty menorrhagia, during geriatric lady, in postmenopausal lady, there are so many segments in which you can use
Everywhere it can use.
carboxy maltose. Whenever there is iron deficiency anemia, you can use FCM, and thanks to API production like you, giving it a very economical cost, patient friendly. So now people are using it, and you can quote my 2017 paper that this is safe. So 2017 to 2024 till date we don't have seen any anaphylactic reaction or death because of FCM. So all the viewers, there is my humble request that use FCM. It is a very safe molecule, and thanks to company who are making API of that. Thank you very much.
Thank you, sir. Thank you very much for coming and contributing to this subject, sir. And we thank you for your contribution to science in general.
Thank you.
very much,
Thank you for calling a person from very small town. That
No,
is
no, no, no,
Surendranagar,
sir.
Gujarat.
Thank you very much.
Thank you, sir. Sir, okay.